Dr. Felton here, going over how to give low volume subcutaneous fluids to your cat. So normally when we give subcutaneous fluids, we often will use the measurement on the bag to give fluids in 100 or even 150 milliliters doses at a time. In Prism's case, we're going to do low volume, and so we want to use a syringe that will allow us to measure 30 milliliters for her. And this is a 60 milliliter syringe, so we're going to use half of it. Really important, this is a sterile syringe. I just took it out of its casing. Really important not to touch the end where the needle attaches to this, and not to pull this syringe apart and pull the plunger out and be putting it back together, because we could contaminate the inside of the syringe, because we're going to try and reuse these a bit. So as soon as I've taken this out of its kind of carrier, I will go ahead and take a sterile 18 gauge needle and I will put it on the end, and it will protect the end that I'm supposed to keep clean. So it'll help keep everything clean. And then I'm going to pull my 30 mils into this syringe, because I'm going to use this syringe to give her the fluids. And each fluid bag's a little different. This one, you pull this green part off, if I can, and there's a port, and that is what my 18 gauge needle is going to go into. So I use this, I do this hanging because it's just easier. I go ahead and put it all the way in. Using an 18 gauge needle so this goes quickly. You can use any size gauge needle you want, but it'll take longer if you use a smaller one. And I go ahead and let whatever air has come in, I let go ahead and go back up into the bag so that I've got exactly 30, just like that. I'm careful not to touch the needle when it comes out. I go ahead and recap it. I'm going to use this needle as a cap later, so I'm going to keep it clean as well. So I'm going to take it off of here. Again, I'm not touching the syringe. I'm putting my little cap back on this and keeping it separate from my others because it's been used, but I'm going to use it as my cap later. And again, I'm keeping the end of my syringe clean. I'm going to now put my butterfly needle on. That's what this is. They call it a butterfly because it's got wings, and it's got its own little kind of, looks kind of like your drip set, like you're used to, but much smaller. So I go ahead and put this on the end of the syringe like this. And I go ahead and prime it. What that means is go ahead and push fluids into the little hose all the way out, and you can see it started dripping out like that. And then I'm ready to give her her dose. So this is a 19 gauge needle. It's a lot like the 18 gauge needle you're used to using to give subcutaneous fluids. And this gives you a little flexibility. So if Prism wiggles a little bit, I'm not gonna immediately pull this out. You know, she's got a little bit of wiggle room. So I'm gonna set this close to her. I'm gonna let her be in her carrier for this so she's comfortable. This has a flexible little tube that's the cap. That's different than a normal needle. So I hang on to this too so that I can resheath it. I go ahead and place the needle like you would an 18 gauge, like that. And I go ahead and slowly give the dose. You don't have to go too slowly. You can make it actually pretty quick for her if you like. And it goes just like giving it gravity fed, except you get to control the speed. Because I'm gonna reuse this syringe, I never wanna pull back. I just wanna push forward with this. So I'm trying to keep the inside of this big syringe sterile. Just like that, and we're done already. So then I'm gonna just give her a little pinch and take it out, and we're done. Now to store the syringe, now this butterfly needle we can't use again. So this we're going to carefully sheath and store until you can bring it back to us to take care of for you, the sharps. We can take care of that. And then I have my needle that I used that is uncapped, and I'm going to store my syringe with this on it so it's kept clean for next time.